All right, good evening, everyone. My name is Sarah Smith. I'm in the Tumwater School District Communications Admin Office. And I do have our session tonight recording. So for questions, confidentiality, just so you're aware, we do have it recording. For tonight, we have Miss Candyce, and we're touching on teens and depression. So,
and anxiety.
And anxiety as well, yes. I do have hand raising set up. I will be watching the chat. So if anybody has a question, please leave it in the chat or raise your hand and I can unmute you. And we'll go ahead and let Ms. Candyce get started.
Okay, so let's go ahead and start tonight. And there's a lot to cover. And so we'll just kind of cover as much as we can tonight. I want people to feel free to ask questions anytime. Don't feel like you have to wait. Try to remember to give little breaks in between as well. But I do want people feel free to ask questions, and then Sarah can unmute to get those questions. So we're going to start, I think, talking about anxiety first, and then we'll talk about depression. And I want to talk, first of all, a little bit about sort of the context of that sort of we're interfacing with. So we're always looking at anxiety and depression in adolescence. In the best of circumstances, it's a period where we deal with both in adolescent development. But with this particular time, with the stress of COVID, interfacing with this, we're going to see that, and we have seen that we actually get what we consider to be what we call then you have all the complexities and all of the high emotional loaded incidences of grief and disappointment and fear and uncertainty and resentment and unfairness and isolation and loneliness. It's like there are so many emotions happening that what happens is we call this, when this happens, we call this when things get amplified. So the normal anxiety and depression that we always struggle with during this age group only is, quotes, amplified right now by what we and our children have been going through in terms of COVID. Now, with that said, and starting with anxiety, I want to separate out anxious and anxiety. So anxiety is a clinical condition, and it's when you have sort of a chronic level of anxious feelings about several different things. We can see performance anxiety. Some kids have performance anxiety. Some people have social anxiety, some people have separation anxiety, and some people have what we call generalized anxiety disorders. And that's where they just, every one of those, performance, social, separation, and you see all of them. When we are dealing with anxiety, and I like kids to know, and I like parents to know, that anxiety per se is normal. Being anxious is one of the normal emotions that we have as humans. And when we are emotionally intelligent and when we are in situations where we have the ability to be more resilient, we just handle our anxiety. And as I said, that sort of normal anxiety that a lot of us have experienced and your children have experienced has sort of slipped over almost into being a typical kind of clinical condition, just because it's been such a long period of time of this amplified emotional state. So just in general, what you see in terms of physical manifestations of anxiety are things like decreased appetite, sometimes eating more, but eating more, eating less. You'll hear more about complainings about headaches or nightmares come up a lot, or sleep disturbances, hard to go to sleep, hard to stay asleep. Stuttering comes back in, what we call normal non-fluency. Kids who normally are quite fluent, you'll notice a little more stuttering than usual. A lot of complaints about upset stomachs or kind of vague stomach pain. So those are all sort of the physical manifestations when we have kids who are dealing with anxiety. Emotionally, behaviorally, you'll see and hear them talk more about things that they're worrying about. They become more kind of obsessive about things. They have trouble relaxing. This is related to that hard time going to sleep. They have a lot of new and old reoccurring fears. So fear of the dark, fear of being alone, fear of strangers that you may not have seen for a while. They're clingier oftentimes, a lot of questions. They'll be asking, what's going to be happening? What is happening? Just so questions are very common. Some kids manifest their anxiety as anger, and people confuse anger and kind of what would I call it, anger and sort of oppositional behavior. And sometimes if I can ask parents questions about some of that behavior, I'll be able to turn that back around and say, what you're seeing is anger and is anxiety, and it's manifesting as oppositional or angry. Crying, whining are typical. Sort of the inability, more volatility and their emotions, just harder time really mediating their own emotions and being sort of self-moderating around emotions. They're more stubborn. That's kind of the oppositional behavior I was talking about earlier. Some regression in things that we hadn't seen since they were quite young can happen, and an unwillingness to participate in family events or school activities. All of those are pretty typical emotional, behavioral sort of things that we'll start to see. Now, one of the things that is really important is to normalize this. Is part of the reason I want to start talking a little bit with COVID and normalizing anxious as a feeling. I want kids to recognize that as humans, we all have anxious feelings with something new, something different, etc. And part of what feeds anxiety is anxiety about being anxious. And so by normalizing, we can diminish some of the anxiety that we tend to see with kids. The other piece is that I want to remind people that people who are predisposed to anxiety tend to be what I call have spongy temperamental characteristics. They basically are very vulnerable to sponging other people's emotions. And one of the things that has happened during this period is that if you are someone who does have that sort of predisposition, which is genetic, it's a temperamental predisposition, they are sponging your anxieties as parents. They are sponging their peers' anxieties, teachers' anxieties. So they are these little sponges that not only they're coping with their own anxiety, but they are having these additional sponged anxieties that they're dealing with. So I want to sort of have you be aware of that so that you can be conscious of, am I managing my own anxiety? How much am I exposing them to other people's anxiety, etc., and have them at this age, which is nice, by middle school and high school, to be able to talk about that temperamental characteristic of sponging other people's anxiety. So they have ways, for example, of coping with that could be a little different. And then what we also want people to be conscious of around anxiety is that same temperamental characteristic oftentimes is really closely paired with perfectionism. So a lot of these kids who have that spongy sort of temperamental characteristic also have a lot of performance anxiety and really make assumptions that people are expecting high levels of performance and perfection from them. So we oftentimes will have to work on both anxiety and perfectionism with those kids when that's happening. The other thing that interfaces with this is development. And we know there are different stages and ages of development that tend to have more anxiety, and ages and stages that tend to be a little more self-moderating around that anxiety. So you'll see their anxiety is dynamic in the sense that you'll have good years and bad years, or good months and some bad months in terms of anxiety. Okay, so that's kind of the generalized information in terms of talking about recognizing anxiety. So questions about that before we move on in terms of sort of managing at this point. Does it look good to go, Sarah?
Yeah, I have nothing in the chat.
Okay, so let's talk a little bit about management. I'm going to talk first, I think, in terms of really being able to talk about what that.
Candice,
Yes.
I'm sorry, I do have a hand raise.
Oh, okay, go ahead.
Miss Laura, please go ahead.
Hi, Candice. I don't
Hi.
my videos on. I've met with you years ago. My name is Laura Moxham.
Hi, Laura.
I have a now 13-year-old girl and a 10-year-old boy. And we have been dealing, we've had some issues with what you were talking about, periods of anxiety and, I think there's been also not just COVID, but other things in life, the normal things, like that sometimes happen
Absolutely.
a child's life, like in my instance, undergoing separation and divorce. And so that was a big stressor. And then COVID hit and, having the stay at home and try and do the at home schooling thing and being separated from friends. I mean, all of that kind of collided together. But just like I feel like with hormones and COVID and this period of time in their lives and with everything going on, it's like I guess I struggle because I feel like it's not just my daughter that is experiencing
No.
this anxiety, but we as parents, like, how can we help calm and like provide that assurity, because it could be anything that sets them off. It could be the tone of my voice that is
It is
upsetting.
really hard. I mean, and part of this, Laura, is that it's one of these times when we're not just talking about even managing our kids' anxiety, it's that it is really a time when we have to really be conscious of self-care and managing our own anxiety. And I think that's part of what's happened is we have parents who are and teachers, other adults who are struggling so much with their own sort of emotional bankruptcy that it makes it harder to be that person or those people who help kids feel more reassured and centered. So it is a really systemic almost issue right now in terms of managing this. And that's what I want to talk about next. Like, what can you do as parents and as teachers that can help?
Okay.
What can kids do to help themselves? And I think one of the things I really want to talk about a lot in terms of having a lot of impact is I really feel like one of the things we need to be doing more of that I think has been an issue systemically in this generation anyway, is to really reframe for our kids that they have the resiliency to manage this. And I know that it feels like in many ways to both the adults and the children that we don't have the resiliency. But for most of your children, the things that it takes to be resilient, they actually have. And I think that the worst thing we can do for them is to see them as incapable of being resilient, because if we can't see them capable of resiliency, they can't see themselves as capable of resiliency. With that said, I'm oftentimes saying to people now, it's like, it's important not to see your children as fragile. They are sensitive. And that is not something that we want to change. Being a sensitive person is probably something we've all worked on with our children in one way or another. But I think sometimes what we do is we associate those two things ourselves with sensitive being fragile. And I want us not to give our children the impression that they are fragile. I believe in them as being resilient, and they need to see themselves as sensitive, capable of struggle, not fragile about struggle. Does that make sense?
Yes, that makes sense. And so you said you mentioned that you'll be talking about how we as parents can
Yes, that's
best
what we're
help
going to
our
talk
kids
about.
that are struggling with some anxiety and levels of depression.
Exactly.
I mean, I think the other complicating factor, and I know my fiance is tuning in as well, is that so I've gone through a divorce, and our kids, both my fiance's kids and my kids, are going through that adjustment. And then now we're engaged and we're combining households. And
Right.
so that brings a new complexity to it. And we both have 13-year-old girls and we both have 10-year-old boys. My fiance has twin 10-year-old boys and I have a 10-year-old boy. And so there's 5 kids total. And so I understand we particularly have a lot that we're trying to manage and parent. And like you said, I mean, it's really also taking into consideration what we as parents are going through with the levels of anxiety and strain and even some levels of depression. I mean, with the seasonal
Exactly.
depression that happens and you as
Absolutely.
parents are trying to balance all of that. And I don't know about you, but like my counselor, she stopped counseling because she was going through her own she had to
Yeah.
take a hiatus from counseling others because she was having some of her own concerns. And so yeah, I guess I'm really looking forward to that conversation later.
Okay. That's what we're starting on now.
Thank you.
You're welcome. Are we good then, Sarah?
Yes, we are
Okay.
good to go.
Okay, so let's talk about, first of all, what parents and teachers can do, and then we'll talk about what kids can do to relieve their own stress and anxiety. So in terms of parents, the adults, they can provide a safe, secure, familiar, consistent, dependable home. And I have to say, interestingly enough, one of the things that's happened with COVID is in some ways, because we've had to all be more isolated and more home, there's been a connection and a routine that we've sort of gotten in homes that we haven't had when we were busier and sort of all out and about and doing more. So in some ways, we are providing one of the things as a result of necessity, providing one of the things that's important. I think that what you said, Laura, about you have changes coming is going to be one of the things that you want to think about, because you will be changing some of the familiar, consistent, dependable home sort of environment that your kids both in each of their homes have been used to. I think talking about that openly and strategizing around that openly is going to be really important and helpful. So that's number one, providing that safe, secure, familiar home space. The second thing is being really selective in what you are watching around news broadcasts with your children and yourselves, is that you can actually produce more fear and anxiety. And I generally will say to people, you literally do not need to check in on the news more than once a day for the most part. And so people who have sort of that constantly on TV with news running in that sort of 12-hour cycle, it's really produces more fear and anxiety in yourselves and in your children. So being conscious of what you have sort of playing in your background is important. I think it's important that there's, again, and as out of necessity, we've seen more of this, spending calm, relaxed time with your children. And because we were forced to, I have had parents who have talked about kids with anxiety, who their anxiety actually diminished during this period because a lot of those external stresses were gone and there was more time spent at home and together. So spending relaxed, calm time at home is really helpful. Encouraging your children to ask questions. Now, I want to talk about this in two ways. When we are anxious, the more we know, the more that we can predict, the more that seems familiar to us, the more we can manage our anxiety. So oftentimes when people are anxious, they ask a lot of questions, including children. And it's really important that you know, for the most part, answer those questions. So a lot of times kids will say, what are we doing tomorrow? And as specifically as possible, you will sort of spell out the day so that they have that familiarity and consistency. That is important to be able to do. With that said, when we start to flip from anxious behavior into obsessive behavior, we will tend to ask the same question over and over again. And I don't mean the same question like, what are we doing tomorrow? But the kind of questions like, are you going to be home when I get home from school? Are you going to be home when I get home from school every day? Or did you lock the doors? Did you lock all the doors every night? They ask. That is what I call the kind of question that feeds the monster a cracker. And by that, I mean, we all have this part in our brain, this portion in our brain, where we manifest anxiety, worry, and concern. And it's normal and it's what keeps us safe. But sometimes we overactivate that. And when we overactivate that part of our brain, it's like a little monster who needs the cracker fed. And so they get reassurance and they get their cracker by hearing you say, I checked all the doors every night. And so then they ask it again. And it's like the more they ask it, the more activated part of their brain. And all of a sudden now they're saying, did you also check the windows? They might also then start adding, did you check the doors, the windows, and be sure the stove was turned off? They start activating that part of their brain, and then they just constantly need more and more reassurance. When that starts to happen, I don't want parents answering that question. I want them to say, we are conscious of taking care of what needs to keep you safe at night. And you say, we've already talked about this. And you don't feed the monster a cracker. And you literally say, you're feeding the monster a cracker by asking. So you're basically teaching them how to deactivate that sort of obsessive thing. So that's why I said there's sort of two sides of encouraging them to ask questions and, you know, and expressing concerns and worries. So questions about that. Okay. The next is being sure that you really are listening to what your kids are telling you and not feeling like you need to be critical about what you're hearing or trying to necessarily always fix what you're hearing. But it is important for them to know that for them to feel heard about these emotions that they're experiencing. But I think for some of us, the message we have gotten ourselves about our role is that if we hear that they're having emotion, we feel obligated to fix it. And that is not necessarily setting your kids up to be resilient. Okay, building their sense of self-worth, being sure that they feel good about who they are, what they're doing, how they're doing. Trying to be sure that you use positive encouragement instead of punishment or criticism. And what you're going to find is the more anxious and fearful you get as an adult, as a parent or a teacher, the more vulnerable you are to being punitive or critical. And so it really is going back again to, you cannot work with a child's anxiety if you are not working with your own anxiety and bankruptcy and overwhelmness. Allowing your children to make choices and have some control in their lives. Anxiety is about being out of control. So as many ways as we can provide healthy control, we want to provide healthy control, letting them make choices that impact them, letting them feel like they can have some say in what will be their predictable outcomes for the day. So anything to give them a sense of control. Learning to recognize that they're having some of these unresolved stresses in their lives and bringing their attention to it, with the idea that you're going to take action and help them take action to resolve some of those stresses as if possible, and doing that. And then just really keeping your children informed of necessary and anticipated changes. And it's one of the things that's been so hard right now during COVID, is that we've had so many necessary, but so many unpredictable changes as we try to navigate through the pandemic. And so that lack of sort of predictability and adapting to changes really makes a difference. Now, one of the things that is important to understand about anxiety and depression is that there's a lot of genetic predisposition. And so oftentimes the kids that we see have that generalized anxiety, generally we can recognize it in either one of their parents or both, or sometimes we'll see it in a grandparent or in an aunt or an uncle. So there is a genetic predisposition, which makes some of us and some of our children more vulnerable to having to really manage anxiety than other children who don't have that genetic predisposition in your home. Okay, so that's some of the things that parents and adults can do to help.
Miss
Now,
Candice,
yes,
we do have a question from Ruth. What if their decision is to do nothing?
what if their decision is
To do nothing.
okay, so meaning that the way they're coping with their anxiety is just to kind of shut down?
I believe that's when she came in with the message.
Okay.
Here,
So,
hold on. Let me see if I can get. Miss Ruth, can you elaborate? Go ahead and unmute yourself.
Can you hear me?
no.
Yes.
Oh, yeah, now I can. Okay, go ahead.
So basically what this was in regard to was you talking about letting them start to make their own decisions, let them think about what they want to do, let them help decide. So you say, hey, it's Saturday, I don't have anything planned today. What would you like to do? Allow them as part of the decision-making process, and their decision is to stay in their
Nothing.
pajamas and watch
Yeah.
TV.
Okay, so part of that is, and this has been true of all of us, is there's a certain level of where we have our comfort zones have gotten really small. And so our children's comfort zones have also gotten very small in terms of they're just more comfortable being home, being on, screens, whatever that may be. And I think talking openly about that comfort zone, but the importance of expanding those comfort zones and being able to be really clear that as those comfort zones get smaller, so does our confidence gets less. We get less confidence and less competent. And then as we get less confidence and competent, those comfort zones are even smaller. And so little by little, all of us are going to need to just gradually get those comfort zones bigger again. And so it may be, Ruth, for example, that rather than say, what do you want to do, that may be too much out of their comfort zone or feel too big. It could be that you would give them an option of two things. They may say, I don't want to do either of those, but ideally you would pick things that they probably would on some level enjoy, or for a shorter period of time or whatever. But you would also be really clear about talking with them. I mean, one of the things I love about dealing with older kids and anxiety is we can talk about these principles with them. They have abstract thinking. I want them to understand these processes that we go through in our brains and that happen in our brains. And understand about comfort zones, and that they're going to be uncomfortable, that they would be more comfortable perhaps staying home, and that is not necessarily what is healthier for us. And so we're going to talk about what's functional versus comfortable, and then see if we can help them little by little increase those comfort zones. I hope that's enough to answer that, Ruth. Did that help? Okay. I'm going to assume we're okay unless I hear back.
Yes, thank you, she says.
Okay. Okay, good. All right. So let's talk a little bit about what kids need to do and what they can do, because at this age, again, I really want kids to understand that they have some impact and control over the level of anxiety they have to deal with. Now, again, I really want to separate this out from what we would call the clinical condition of anxiety, where kids may have to have medications if they aren't able to, be able to manage with help from the adults and themselves, or counseling, again, is helpful for kids because it's another form. So some of the things you can do is talk about your problems with other people, with the counselor. Some kids really do well writing. Some kids do well with what we call dialogue journals, where they write something and you write something back and they write, because they do better without sort of the face-to-face energy they have to deal with in facial expression and body language. And so they but they still do want to have that communication. So talking about what they're feeling, what their concerns are. So communicating to a parent, to a teacher, to another adult, a counselor, is important. And I do want kids processing with each other, but what I want them to understand is that there's a limitation to just processing with each other, because they are all in a developmental stage where they don't have the brain development or the life experience that may be helpful for them in terms of processing some of the things they struggle with. Okay, the second thing is really helping them learn how to relax, learn how to get what we call centered. And this is interesting because we have a difficult time with this with children, because we have a generation of parents who have a hard time knowing that they need to, when they need to, and how to get centered. So generally the way you center is with your senses, and we tend to be predisposed to certain centering predispositions. So some people are visual centers, and they may do well looking out a window and looking at nature. Or they may like watching something, a flame flicker, for example, and that's centering for them. They're visual centers. Some of us are auditory centers, and listening to music or having a window open and hearing nature sounds is centering for us. Some of us are kinesthetic centers, where we have to move, and you'll see people who kind of just constantly rock or kick a leg as a way of centering. That those are kinesthetic centers, and some people run or shoot baskets to get centered. Some of us are oral centers, and as adults, you may eat or have a glass of wine, or kids and adults may bite their fingernails. Those are all oral centers. The whole thing is to be really clear that we all need ways to center. And when tactile center is the other one I didn't mention. And so some people will fiddle with an earring or play with a ring or twist their hair. Those are tactile centers. So what I want people to be doing is modeling centering as a coping mechanism, that knowing that when they have that sense of being out of that sense of well-being, that they know to get back to that place of well-being, they have to do a centering activity. The more centering activities you have in your repertoire, the easier that is. If the only way you center is to run, you can't run all the time. So you would have to want more than running in your repertoire. Or if taking a bath centers you, what other kinds of tactile centering could you build into your repertoire? So the greater your repertoire, the better. So recognizing when you're out of that state of well-being, and then recognizing what's in your repertoire to get you back to that state of well-being. Okay, so that's the second thing that you can do. We know exercise is important for reducing stress and really triggering the hormones in our brain that help us feel like we are in that state of well-being. And so exercise is important. Again, one of the things that tended to drop off in the way it should have been for most people during COVID. So what we look at is I encourage at least 20 to 30 minutes of pretty active, a brisk walk, jumping on a trampoline, any kind of physical activity that would induce some of those hormones. Setting realistic expectations is really important. This is that piece about perfectionism, helping your kids recognize that they can't and there isn't any such thing as perfect, that they can strive for excellence. They can even strive for excellence sometimes, and that it's okay not to strive for excellence all the time, and that it's okay to strive for excellence in some arenas and moderately successful in others. So really helping your kids understand that what are realistic expectations about doing their best. Nobody's perfect. Nobody's capable of perfection. Learning to be really good about doing self-care and self-respect. One of the things that our kids learn very quickly, and generally from adults around them, interestingly enough, is that they learn to say things to themselves that become self-fulfilling prophecies. I'm really stupid, or I can't believe I think like that, or why can't I be more like, or I should have. Those are all sort of the talk that is self-critical and non-self gracious, self-loving, and they become like these deep ruts in our brains and cause us a lot of anxiety. And so teaching kids to have positive affirmations, to learn how to shift some of those, the ways that we talk to ourselves internally, as well as externally, and really being conscious about what our self-talk looks like and where that self-talk comes from and how to put up roadblocks to that negative self-talk. And sometimes we need cognitive behavioral therapy, they call that, to really deal with that. And we see that as well with depression. And so we may have, that's where you may be looking for someone to deal with your child in terms of a counselor and so on. The next thing is remembering that drugs and alcohol only make anxiety worse. It is really common for adults and for adolescents to self-medicate anxiety. So we see them doing a lot more smoking pot. We see them doing a lot more alcohol, drinking alcohol. They do get and can get an immediate response sometimes from that, but especially understanding that some of that can actually escalate their anxiety. Sometimes certain types of pot or certain people who drink or use marijuana, certain kinds of marijuana, make people more anxious rather than less anxious. Some people don't recognize that alcohol is actually a depressant. So you may have that first sort of feel good feeling, but as it wears off, you go deeper into depression because it is a depressant drug. So understanding that for the most part, they don't work. The other thing that I don't like about kids using alcohol and drugs as in terms of self-medicating is it's not a predictable form of or a predictable form of medication. They don't know how much of that medication they're actually putting into their body. The second thing about that is if you are self-medicating, sometimes you don't have then the ability to recognize what your issues, concerns are that you actually need to work on, that you actually need to be changing in order to have the long-term impact that you're looking for to diminish anxiety. So generally discouraging use of drugs and alcohol as a way of self-medicating. And then just knowing and really reassuring your kids that asking for help is a strength, not a weakness. And there's still a lot of stigma about being healthy, including mental health. And so a lot of kids, when they hear mental health, still hear crazy. And I want people to be clear that when you are reaching out to get mental health, it's no different than reaching out to a dentist to be sure you have good oral health, or to a doctor to be sure you have regular checks up for good physical health. So really changing that. The other thing we do know is that dietarily, and this has been a bit of a problem because it's been harder for kids to sort of manage and for parents to manage food because it's been one of the ways we've all been self-medicating. But we know protein every couple hours generally tends to help people who are struggling with anxiety. So being sure that your kids have access to and understand that they need to be responsible for seeking out protein every couple hours is important. Okay, so anything else about anxiety that you want to talk about before I move on? Okay, couple last things about anxiety before we move on to depression. I want people to understand the difference between feeling super anxious and actually having panic attacks. Panic attacks are really common for adolescents. And so I want to normalize that. And it's common for them to have them at a quiet time, interestingly enough. So a lot of kids will say, I'm having a panic attack, when really what they're having is a high state of anxiety because they are going to have to speak to the class and give a report, or they have some kind of performance they need to do, or so that would be having a high state of anxiety, but not necessarily a panic attack. Panic attacks generally are the way they sort of manifest is you'll have a really high heart rate, oftentimes abdominal distress. They'll feel kind of faint or numb. They may shake or tremble, shortness of breath. A lot of times people will think they're having a heart attack sometimes, and really what it is a panic attack. For any of you who've had one, you know exactly what I'm talking about. It's important for kids to understand that they oftentimes happen at quiet times. So they'll just be ready to go to bed, and sometimes they'll have a panic attack right before they fall asleep, or just sitting quietly, and all of a sudden they notice they're having what feels like a heart attack, or they can't breathe, or their throat feels swollen, or it's important to know that they generally last only 20 to 30 minutes. Which seems like an eternity if you're having one, but it's important for them to know that there's a natural bodily response. Our bodies can't sustain panic attacks, so we generally will be over them. They'll peak in about 10 minutes, and 10 minutes or so later, they're over. And just knowing that can help people get through panic attacks. It's also super important that they try, if they can, to get outside, to go outside and walk. Generally, cooler air helps with panic attacks and breathing. So sometimes you may find yourself at bedtime taking a walk with your kids if they tend to sort of go into panic attacks at night. That's helpful. Sometimes bearing down, almost like you're trying to have a bowel movement, can help, because it really, that affects the vagus nerve. And so when you do the vagus nerve, that can sort of a short circuit, having sort of that heart palpitation stuff and the stomach pain stuff, and that will shorten a panic attack. So sometimes with kids, I'll say, go in and try to have a bowel movement. And all I'm looking for is for them to have that sort of attempt to bear down and stop that nerve response. So, but the biggest thing is normalizing them and really helping them understand that because the first two things that most people feel with panic attacks is they're either going to die or they're going to go crazy. Both those are the two things that people will describe as their biggest fear during a panic attack, and to reassure them that neither of those things are going to happen, and that their body is going to stop this regardless of what they do within 20 to 30 minutes is really helpful. In terms of sort of dealing with more of the performance anxiety, one of the things that I want kids to know is what we call, I think I gave you a copy of this, is sort of the aware approach. And that is, you accept that you are feeling anxious about something, and then you rate it on a scale of 1 to 10. And the reason we rate it is I'm trying to get kids out of their emotional part of their brain, where they're experiencing and triggering the anxiety, to the more linear, logical part of their brain. And so by assessing it, like I'm at an 8 or a 9 in my anxiety, I'm pulling them away from that. And then I'll say, take action. So as if you weren't anxious. So even if you are anxious about getting, dressed and ready to go on that run or take a run, you do it anyway. You just do it mechanically, and really expressing that action is important even if you don't feel like it. So you take the action as if you weren't anxious about it. Once you start taking the action, then I'll say again, where are you now? Oftentimes I'll say, I'm at more like a 5. And I'll just have them do that so that they recognize what that process looks like to sort of back it back down, and then eventually then they just move through it. So again, it's that piece about the more we feel like we have control over something, so having a process to diminish your anxious feelings with an event is really helpful. All right, so that's the information I have for you tonight about anxiety. Any other questions or comments that you might have around anxiety before we start talking about depression?
Candice, we had a question in for Laura. I just wanted to check in with Laura to make sure her question was answered.
Okay.
Yeah, I guess, Candice, thanks so much for all of that information. It's super helpful. I really do appreciate it, and I appreciate the things that you bring up that, you know, I've thought about in the past, and maybe it hasn't been as fresh in my mind right now.
Right.
But you know, I think I have a 13-year-old and she gets overwhelmed. And when I see her getting kind of overwhelmed and flooded, she shuts down and doesn't want anyone to speak with her. And it really affects the entire home. So when your 13-year-old daughter, and I'm sure other people can commiserate with me, when your 13-year-old daughter shuts down and is just, it's like walking on eggshells. And
So,
so
yeah, so
how
what's it? You know, you're right about the flooding, Laura. You got that. You know, you definitely have that concept. She needs to understand about that concept, and that it's about 20 to 30 minutes that the physical aspects of flooding happen, where you can't think, process, take action. And so during that 30 minutes, I'm okay for her to shut down and go away and nobody talk to her for 20, 30 minutes. But she needs to go away. She can't do that in a group setting, for example.
okay.
She needs to go get her, and then during that time, she has a job to do. Her job is to get centered. And there's where you would talk about centering with her.
Mm-hmm.
And then she comes back out and should reinitiate whatever is going on that you need to talk about or take action on.
You know, I appreciate that. She'll get flooded and then I'll say, just go take time. Like, but I can't even say anything because she'll tell me that my voice just makes her mad.
And so even a signal, I mean, even just giving
Yeah.
a timeout signal is good enough. But when she is calm, like when you're flooded, is not a time to coach kids ever,
Yeah.
or coach anybody ever. And so what really has to happen, Laura, is you have to wait till a time when she's calm, centered, and say, hey, when these periods happen, this is what we are going to do to manage it. And this is what you can do to manage during that period.
That makes sense. Yeah, that's helpful. I mean, there's going to be situations where she can't, you know, she can't step away from other people.
Exactly.
The social
And then
setting.
it's really important for her to be able to identify that she is flooded, so that people around her, they don't have to walk on eggshells. They just have to know, I need 20 or 30 minutes of nobody sort of engaging with me for a bit. But that has to be done respectfully.
Mm-hmm. Yeah, I think that's the big challenge, right?
Yeah, exactly. But again, that coaching's not going to happen in a state of flooding.
Right.
That's going to happen when she's calm and relaxed.
Which I will add, it's hard to find when you're dealing with a hormonal 13-year-old.
Exactly. Exactly. Yes.
Thank you.
You're welcome.
Candice,
Yes.
I have another question that kind of goes in with what you guys were speaking of. Ruth has a question about, what about if this happens on a bus with other kids?
Happens on the bus, did she say?
Yeah, on the bus, and there's other kids there, there's other kids around.
That they get flooded? Is that the piece?
I'm going to ask Miss
Okay.
like to elaborate on
Yes.
that. She says yes.
Okay, so that's tough, because the truth is that you know, they would have to be able and comfortable to say, I just need a few minutes to get centered, or just I need a few minutes to get myself focused, or whatever. And for a lot of kids, their imaginary audience wouldn't allow them to do that, which means that they probably are just going to have an extended period of that flooding until they can get someplace where they can get that space. So as soon as they would get to school, they would find a place or a person who would give them that space. It might be that they would walk directly to the counselor's office and say, I need, you know, 20, 30 minutes to get centered, or to their teacher and say, can I come in because I'm flooded and need 20, 30 minutes to get centered. So, you know, when you don't allow someone to get centered, that uncentered, that flooded place will continue until they can actually have a place to get back to that place of well-being. Okay, anyone else?
I am not seeing anything else, and Ruth says thank you.
Okay, so let's talk a little bit now about depression. So again, we're seeing a lot of depression. We always see quite a bit of depression and with teenagers, more so now, both adults and teens, just because of what we've had to struggle with. So occasional melancholy and bad moods and short periods of feeling down is normal. So one of the things I want to always start with is normal ups and downs, particularly in this generation of parenting. Any kind of uncomfortable emotion we've sort of immediately tried to make our kids feel better, or we've worked very hard to avoid them ever having an uncomfortable emotion. So a lot of kids who have normal ups and downs of emotions, which is not depression, they feel they're scared by it, which causes them anxiety. On some level, they believe they're depressed. So I want to be sure that they know that we all, as human beings, have normal ups and downs throughout the day, and other, you know, within a week, for example, and bad moods of feeling down. Then depression is a more persistent sad mood, irritability, feeling of hopelessness over a period of time, a longer period of time. So when we talk about depression, generally in terms statistically, we generally see about 1 out of 8 teens experience true depression. And it's common in all races, all colors, all socio and economic groups. More frequent in females versus males, although there's a lot of question about that now, because part of the problem is that males learn from a very young age of socialization by other males that it tends to be seen as weak to identify emotional states or mental processes. So I am not convinced, as a lot of other professionals aren't convinced, that we see more depression in females. I think it's identified more in females than it is in males. Many people don't recognize depression in themselves or in other people. So we'll talk about what that can look like. And the other thing is that, and we talked about this, if you see it as a weakness or a character flaw, then a lot of times people don't reach out to get help. And so one of the things that I think has changed, I really feel actually really good about this. I can't tell you how many kids have said to me, they tell other kids that they should have a counselor, or they'll say, my friend would like to come see you, or. It's really important, I think, for kids to really normalize using resources as a way of dealing with depression and or anxiety. And it doesn't mean you're crazy, but we still do have a lot of that old belief system that tends to be an issue because it's so entrenched in us. And sometimes the kids are actually better because they are changing that belief system faster than the adults around them. And I literally will be talking with some parents and I'll say, that sounds, or to me, like you may be dealing with some depression in your child. And I'll say, you know, it might be worth seeking out a counselor to have them assessed. And they will immediately be, oh, no, they're not depressed, because they feel like there's going to be stigma or judgment about having depression. So it's important for us to look at our own sort of intrinsic biases about help and about reaching out for help to people who are skilled, and as well as our children. Okay, so what happens in the brain is really important, because this is what has helpful in changing some of that intrinsic bias. Depression is about brain chemistry, and there are certain neurotransmitters that regulate our mood. And when those neurotransmitters are not functioning well, then we are going to start to see a problem with managing our mood. Now, generally, we talk about depression as one of the causes of depression is that we are genetically predisposed. It is very common that, as we would talk about with diabetes, for example, that we have predispositions in families to have some of those chemical issues that would cause, in some cases, depression. In some cases, it would cause us to have a predisposition to diabetes. We don't judge that predisposition genetically in diabetes. We still have a lot of that implicit bias around depression. But really understanding that what we're looking at here is working with brain chemistry. So there are basically three general types of depression. There's major depression, which is generally severe and short lasting. There's dysthymia, that is longer lasting but less severe, sort of just that constant low level feeling of nothing feels fun, they don't feel hopeful, don't feel motivated. That's more the sort of dysthymic depression. And then there's adjustment disorder with depressed mood, which is a reaction to a specific event. And sometimes adjustment disorders, like moving to a new house or having to change schools or having a new sibling come in can cause that same response in the brain. So those are the three things that we look at. Now, the way you diagnose depression is always challenging. And I think it's part of the reason why we still have so many implicit biases around health and mental health, is because we don't have blood tests, at least not blood tests or genetic tests at this point, to identify. So we identify it by professionals who determine depression by using psychological tests, by interviews with the person who is struggling, or with their peers and or parents or teachers and so on. So it's hard to identify in terms of, we can't really take an X-ray or do a blood test. But some of the symptoms we look at or use for assessment are if there's sort of a lot of chronic sadness or feelings of hopefulness that don't seem to be changing. If we see severe changes in sleep habits, where they have a hard time going to sleep for long periods of time or staying asleep. If we notice changes in eating habits, sometimes that means not eating, or sometimes that's eating more, but major changes in eating habits. When we withdraw from friends, so Isolation, interestingly enough, can be one of the things that can trigger depression. And why? Because of the pandemic, that we've seen higher rates of depression, or what appears to be higher rates of depression. And it can also be one of the things that's a manifestation, because as we get more depressed, we tend to go more inward, where we don't want to be around people because we don't feel like we're that interesting, or it takes too much work to engage. So it can be a manifestation of depression. It can also be isolation can cause depression. Another thing we look for are lack of concentration. Kids will start to have trouble, for example, focusing in school, remembering things, that kind of thing, which will give us a sense. They'll be more indecisive, for example, which would be, with other of these indicators, an indicator of depression. When we tend to overreact or be overcritical, can be an indicator in combination with some of these other characteristics. Feeling worthiness, or a lack of worthiness, actually, feeling not worthwhile or guilty about things more than normal. Feeling that nothing is worth the effort. Oftentimes, one of the big things we'll see is a lack of motivation as an indicator of depression. Frequent health complaints, more unmodulated emotions. So you see more sort of anger, raging, anxious behavior that is considered normal for that person. A lack of enthusiasm. Drug and alcohol abuse. And drug and alcohol abuse is an attempt to self-medicate mood disorder. And then a preoccupation with death or dying. And this one has been really hard because we've had so much messaging around the pandemic, that kids are really aware of death and dying in reality. And if they're already struggling, then of course that preoccupation is triggered. So all of those are considered to be some of the things we look at when we're assessing if a person is depressed or how depressed they are. Now, in teens, there are some really significant things that can trigger depression. Certain events, they are very, very susceptible to that third category I talked about, which is the events that can trigger depression. And part of this is because, if you can think about it in terms of development, our children are having enough brain development by adolescence that they are having more experiences, more understanding of some of the more abstract concepts that we have to navigate through adulthood, and no life experience. So some of these events are way more intense for adolescents than they would be for an adult. So some of the things that we oftentimes will see in terms of significant events, for example, would be, and I think I might have a list of some of them. I do, I'll come back to those, some of those big events that can predispose, but we'll oftentimes see kids go into a major depression after a first serious relationship breakup, because they've never experienced that emotion to that extent, or that attachment to that extent, as in with an adult brain or moving towards an adult brain, but don't have the life experience to understand that they can both survive that emotional intensity they're feeling, as well as that there will be someone else that they will have that kind of bond and emotional attachment to in the future, because they don't have life experience. So that combination of brain development and life experience makes them particularly vulnerable with significant events. Early traumatic experiences. We know that some people will say, I don't understand. So for example, they may have been sexually abused at 7 or 8, but then we see them have incredible response of depression to it, as teenagers. And that is again because they have the brain development and the ability to sort of process things they didn't have the ability to process back at 7. Stress can be another thing that can cause it. Hormones and physical changes can be triggers. Medical conditions can be triggers. Substance abuse can definitely be a trigger. Allergies to foods can be a trigger to depression. Nutritional deficiencies can be a trigger in depression. And then, of course, as we talked about earlier, just those genetic predispositions to depression. So there's a lot of things that can be triggers for in depression for kids through adolescent development. So let's talk a little bit about sort of what are the high risk of factors associated with suicide, because this is always what comes up. And generally, the really high risk factors associated with suicide are previous suicidal behavior, if they actually attempted suicide before. And I want to talk about a little bit about suicidal risk factors, which we're talking about here, and what I would call, so there's suicidal factors, and then there's the whole idea of really feeling like you want to escape. And we call that can be called suicidal ideology. And that what that looks like is that some big event happened, a breakup, some horrifying event of a rape, an abuse, who knows what else could trigger. And there's that sense of, I just want to die. But they don't truly want to die. They want to escape the intensity of emotion in that period of time. And helping kids recognize the difference between feeling actually suicidal and suicidal ideology makes a difference in if they cross over into doing something suicidal, because they're not understanding that what they want is to escape the pain, to escape the intensity of emotion. But true suicidal factors are previous suicidal behavior, history of a psychiatric disorder and or abuse of substance, family history of suicide, much greater risk of suicide if they've had a family member suicide or a friend suicide. Loss of parent by any means is a higher risk factor. History of abuse, violence, or neglect anytime in their life is a risk factor. And social isolation or alienation in this case, like if they are gay and being bullied, we see a much higher risk factor. Some of the events for teenagers that tend to be some of the things that can trigger a suicidal thought are death of a family member, including a grandparent. We've had several kids who have really struggled with the loss of a grandparent, loss of a romantic relationship, especially their first one, is really challenging. Or sometimes just a really close friend can have the same impact. Loss of a parent through divorce, loss of a really attached pet or job or opportunity, loss or fear of punishment, physical, sexual, or psychological abuse in the moment or previously, an unwanted pregnancy. Sadly enough, this sounds like not really, but yes, it is. Poor grades. When we have kids who are very attached to the outcome of having really high performance and tend to be perfectionists, high performance in school, and had been attached, for example, to the outcome of having straight A's and get a B, can actually trigger suicidal thought. Fight or argument with a family member, belief that they have harmed a family member or a close friend, if they've been what they consider terribly embarrassed or humiliated, it can be a trigger. Concerns about their sexuality can be a trigger. And one of the things that I've appreciated is how much more open, at least in this community, kids have been around exploring their sexual and gender identities, and how much healthier that has been. And suicide of a friend or acquaintance. All of these are more likely to make them suicidal. Some of the warning signs of this are threatening to kill themselves, preparing for death in some form, so doing a lot of packing things up, giving things away, giving up on themselves for things, like all of a sudden they had this goal and they don't have that goal anymore. Preparing for death in some way, thinking of trying to think that no one cares about them, no one loves them. You'll actually hear them sometimes express that. Those would all be big red flags that there could be, that they need to be watched. What you can do and what they can't do, and this is really important, and the reason I want to talk about this is that many adolescents are really feeling like they are their ones that can keep their friends and help their friends through depression and keep from suiciding. That can't happen. They are not professionals. And really talking to your kids about when they are concerned and scared, even if it feels like they are in the long run undermining loyalty to that person, they need to talk to a professional to be sure that person can be helped. So one of the things that I say to kids is avoid hanging out with people who are using drugs and alcohol. If you're really depressed, you want to be sure that you're avoiding having to really deal with that. Remembering that you're not alone. It's important to reach out when you're depressed, even though you are not feeling like it, that you mechanically open up your connections rather than shut them down, that you do things that are fun and make you feel good. Even if you know it's mechanical to begin with, the goal is always to do it mechanically because it's likely to impact that brain chemistry we're talking about in the long run. And then seeking out and reaching out to family, to friends, to counselors, and then ideally reaching out to a professional to get some professional input and professional help, doctors, counselors, etc. But above all, I want it to be really clear, don't do anything that will permanently damage yourself or allow someone else to permanently damage themselves. So it is really important that kids understand it is not betrayal to be able to tell a responsible adult if they have a friend that they are concerned about. This is so important. So questions about that at this point? Okay, so let's talk about what kind of treatment options there are available when you do reach out. So one of the problems, if you haven't already found this out, one of the problems we have right now is that it is very hard to find a counselor. At the very least, go to your regular doctor and be sure that you've checked in with a medical professional. Sometimes a medical professional will have access to a counselor or mental health professional that you wouldn't be able to find access to. So don't give up without going to your medical person and seeing what they can do to help you. Generally, what I do is I will say to people, you call someone. If they say to you, I don't have any availability, you say, who would you recommend? Then you start calling, they'll give you 2 or 3 names, you call those and you say, who would you recommend? So sometimes it takes a long process to be able to find someone that you feel could be a good fit, who has availability, but it's really worth the work to do that. One of the things that I would say is when kids are not having a struggle, I oftentimes encourage people to see if you can find a counselor to do either family counseling with, individual counseling with, so that you've already established a relationship with a professional, so that when there really is a serious issue, you aren't having to establish that relationship and that they already are comfortable with that resource. So keep that in mind. So some of the treatment options are individual talk therapy, where they just go in and will talk with a counselor or another health professional. Group therapy, which we are not seeing a lot of group therapy right now, probably will again soon. But because of COVID, of course, and safety issues, there haven't been a lot of group therapy things. But keep in mind that as this opens up, to be sure and look for resources and ask about group therapy. Family therapy is often very helpful because oftentimes depression only identifies the person who is sort of the indicator that there is a problem larger in the family. And so sometimes we call them the scapegoat. And sometimes by doing family therapy, you actually help a child with their own depression and anxiety because you're looking at the larger system issues that may be causing some of that depression and anxiety. Physical exercise always, absolutely, always is important. We know creative expression is really important. So any form of creative expression, changing their rooms up, getting into some kind of an art class, any kind of creative expression, cooking class, whatever it might be, is really helpful. Volunteer work is also one of the things that is very good treatment in terms of depression, is that generally when we are involved with someone bigger than ourselves, our own sort of focus on our own miseries or concerns, our issues becomes diminished. So encouraging volunteering, which again has been really hard and has been more limited, but will start opening up again hopefully soon. And then of course there's always medication and lastly hospitalization. But in terms of medication, I've really been encouraging people with adolescents to be sure that they try to see uh, at least a psychologist, if not a psychiatrist, in terms of medications, because that's their specialty. And because we have adolescents with developing brains, there's a different kind of sensitivity, and having someone who really understands and knows what to watch for and look for and prescribe, I generally encourage them to see, if at all possible, a psychiatrist. And then the last and least would be if they were severely so and were at risk in terms of their health and survival, hospitalization. So that's what it looks like in terms of treatment. And there are different kinds of treatment for that in terms of even individuals and groups. You'll hear people talk about CBT, cognitive behavioral therapy. There's DBT. So you'll hear people talk about different kinds of therapy, and you can actually talk to different counselors about that in terms of what you think would work out for your kids. There's art therapy, etc., play therapy. So that's about depression. I have one more thing if we have time. So let me ask if there's questions first. If there's time, I want to talk a little bit about hope, because hopelessness is part of what causes depression, especially in adolescence, especially in the last generation, and especially right now with COVID and some of the other things that have been happening environmentally, politically, etc. So I want to take a few minutes to talk about hope if we have the time. But I want to check in first to see if there's any questions. So go ahead and ask Sarah questions if you have any.
There's nothing in there yet. We could probably wait just a bit.
Okay, I'm going to go ahead and
I do have one.
oh, okay.
Tracy says, is it possible to get a list of resources?
I wish I could do that, Tracy. I honestly, because of how it's been and how hard it is to find someone, that's why I was kind of telling you what the process looks like. It used to be that we could, you know, give out 4 or 5 names and refer people if there were, we didn't have openings or we didn't think we were appropriate, we would refer out. And it's like we don't even have those references anymore. And that's why I'm saying the best thing you can do is ask friends, call counselors, and then ask the counselor who they'd refer, and then ask your doctor who they'd refer. And it's really so incredibly challenging right now. And so I really personally do not have a reference list. I would probably say to you, though, it might be worth seeing what your school counselors have as a reference list. And I don't know what theirs look like right now, but it would be worth doing that just to see if there's anything that they have available, or asking your doctors, family doctors or pediatricians if they have a referral list. But personally, I don't have anything right now besides that advice. Okay, anything else, Sarah?
Tracy follows up with, yes, it is. We were able to do an intake. They said they didn't qualify for counseling at the time after her doctor referred us there.
It's so frustrating. Do not give up. That's all I can say to you is, like, if that person said they didn't qualify, I don't know anyone who doesn't qualify. That's what I want you clear about. No one doesn't qualify for counseling. In terms of, like I said, I think that just navigating life makes you qualified for counseling personally. And so don't give up on that. You just start reaching out and seeing if you can find someone else. Okay, anyone else?
She says, Miss Tracy says, okay, thank you.
You're
Looks like the chat is clear from there. I have a hand raise.
okay.
Go ahead if you can.
Hi, I just wanted to say I take my son to the Sound Pediatrics, and during the summer, our doctor referred us to a counselor over there at their location. I think they were associated with something Catholic, whatever. So it took maybe 2-3 weeks until the counselor called us, but you know, because they
Great.
were saying the same thing. It's very long, so that was quite fast. It was an emergency program of 10 weeks, specifically dealing with all the anxiety and everything that's happening with COVID.
Exactly.
Yes, and
Good.
we
Great.
did not have to pay for this. So just, you may guys want to check it out and see.
That's great. Thank you, Valentina.
No problem. Thank you.
Okay. Great. All right. Anyone else? Okay, so I want to talk a little bit about hope, because one of the things that keeps coming up over and over again with the adolescents is this incredible sense of hopelessness. And so part of this, remember me talking about with anxiety, some of this is about control, and certainly depression, hopelessness comes into play here. And the belief system that we have unintentionally, I believe, but that we have instilled in our children, and maybe believe ourselves, is that hope is something outside of us, that hope comes from someone's going to provide us hope. And with that belief system, we're very powerless. And in that powerlessness, in the depths of that powerlessness, we are hopeless because we believe it's supposed to come outside and it's not coming our way. And so I wanted to speak to you about what hope really is and help you understand about hope so that you can work with your children about dealing with hope and what hope is, to put them in a position of having more sense of power and control and hopefulness again. So in terms of hope, what we're looking at is optimism. Let's start with optimism. So optimism is the belief that good things are going to happen in the future. That's sort of the general definition of optimism, is that belief that something good is going to happen in the future. Hope is about taking optimism and making it goal-oriented. It's like you have to have the belief that something is going to happen, and then you have to take action. So hope is when you believe you can find ways to achieve the goals and motivate yourself to try to get to those goals. So there are basically three components of hope. They are goals, to have something you want to have happen. If that's environmentally, if that's academically, if that is professionally, if that is in sports, whatever it happens to be, it's like you have to have a goal. Now, interestingly enough, this is where it starts to fall off again, because a lot of our kids actually are very good at having goals, but they are wishes and dreams to them, and they are still wishing and dreaming something out here is going to give them something to get to that goal. So they may have the goal, the wish, the dream, the belief, but they don't understand that they are in charge of that process. It isn't going to come to them, it's going to be from them. So the second aspect, the second component of hope is pathways. And that is, they have to have a vision, a map of how you get to that goal. Like, I want to be a pediatrician. Therefore, I'm going to have to go to a four-year college. Then I'm going to have to get into a medical school. And then I'm going to have to see if I can get a residency. And this is what this path will look like. This is how long it's going to take. Whatever that happens to be. I want to be a manager of a Les Schwab's. How does that look? What's the pathway to become a manager at Les Schwab? And really get clear. So our kids have to have a goal, and then they have to have a vision of that pathway. A lot of our kids have had no practice of that. They've just had wishing and hoping and dreaming, not understanding that it has that piece to it. So you may have to sort of help them recognize what it looks like, verbalize your own pathways, talk about those pathways, etc. Then the third component is, once you have the pathway, you have to really look at your efficacy, your ability to fulfill that pathway. So if you want to be a pediatrician, then that first aspect of the pathway would be you have to get into college. Then what is it skill you have to have? What ability do you have to get into college? Then you figure out what those tools are that you need to fulfill that first step. Then you get to the next step and you figure out what the tools are you need to get to that next step. So you are constantly going to be building ability, efficacy along your pathway. So it is those three components that make you hopeful. That's where hope comes from. So in terms of what you can do around that, you're going to help them, number one, build a future focus. For a lot of our kids, they are so attached to the idea that something out here is going to give them a future, or not give them a future in most of their cases, that they don't even have future orientation. They're like, why go to college? Why blah, blah? It's like, there's no future here for us. So they have to have future orientation. Then you're going to work with them on plans and strategies, help them really look at those pathways. When they're stuck, don't fix it for them. Ask questions that encourage them to take some initiative to figure that out, or figure out what resources they need. One of the issues we've had is we have a generation of kids who are not comfortable reaching out to resources. So we've got to work with them on getting more comfortable identifying and then reaching out to resources that are going to help them figure out both the pathway and the skills they need to develop in order to go on that pathway. Then we have to help them recognize the difference between a dream and a goal, and foster that curiosity and willingness to explore a little bit. It's like our kids, because of our own anxiety about the future and our fear that they are going to have certain things to get to that future, we've discouraged them from exploring their own curiosity, their own passions, and we need to get that back. In order for them to be hopeful, they need to really get more in tune with who they are, what their unique capabilities are, their unique interests, their unique passions. And then from there, we talk about the benefit of that and how to get there with that. And then really, a lot of kids have the grass is greener. I would be happier if I was at a different high school. I would be happier if we lived in a different place. Really helping them understand again that they're always looking externally, rather than helping them understand that it internally is where their power is going to lie with them. So visualize and work with that internal versus externalizing. Build on their past successes. Be sure that they understand and see how they've taken these steps in the past, or how you've helped them take these steps in the past to get where they are. And then be sure you're talking your stories. We have what we all have stories. We all have a life story, or generational stories as far as that goes. And any storytelling helps kids be more hopeful. And so when we talk about stories, we talk about ascending stories, where some of you probably have the story of your family had nothing and then this happened and they got to here and now you're here. Those are helpful. Some of you have descending stories. You had this, and then during World War II, your grandparents were put in a concentration camp. Those are descending stories, but stories still are helpful. The most helpful stories, however, in terms of hopefulness, are what we call undulating stories, where your kids hear all the story, where there's the ups and then there's been the downs, but then there's the back ups again, and then there's the downs and there's the back ups. So telling stories is another way to help kids visualize, see those 3 steps that are hope, and so on. So I just wanted to introduce this concept because I feel like it's such a big piece right now of so many of our kids' depression and anxiety, is their sense of hopelessness, and really for them to have a different way of approaching their future. So questions about tonight? I know that was an awful lot of information in a very, very short time.
Candice,
Yes.
in the chat, if I say this right, Valentina, she has put into the chat the link for Catholic Community Services, and a phone number for
Great.
everybody that's attending tonight. They would like to use.
Great.
She has put the link in the chat.
Excellent. Excellent. Thank you. All right. Anybody else? Okay, that's all I have for you tonight, you guys. Thanks for attending.
Thank you so much once again. So much wonderful information to help our students, our kids get through these times for sure.
Okay, great. Good. All right. Have a nice evening, everyone.
I'm sorry, Miss Candice. What really quick? Oh, it's just everybody saying thank you.
Okay. You're all very welcome. Good night.
All right, everybody take care. Thank you.